with us this morning on this segment of the show, Sonia Bethel, who is our lead doctor here at Green Spring. And she has a very special guest with her this morning that she's going to introduce to us.
Hello, everyone. Yes, I'm so happy to present the newest addition to the medical staff. We have recently had Deanne Zwicker to join our medical staff, and she is a nurse practitioner who has many years of experience and really has a passion for geriatrics.
Wonderful.
Yeah.
Sounds like someone we need.
Oh, absolutely. We have had, a number of staffing, changes in the medical staff recently, and I'm sure everyone, is aware that nurse practitioners really are just a welcome addition to the staff. They are able to see and diagnose and treat just about any ailment that the resident can present with, and we tend to focus their attention in Garden Ridge, but the nurse practitioners also see patients in the medical center.
Right.
And it can vary from something as simple as ear cleaning to diagnosing someone who's having an acute stroke and gets sent to the hospital. Mm-hmm. As long as there is a medical doctor in proximity of the encounter, then the nurse practitioner can work fairly independently and do all of the prescribing and everything that a medical doctor can do. And I know that sometimes is a little, some residents are really not aware of the scope.
Not aware of all the training that they get.
Exactly.
Yes.
Exactly.
I've had wonderful experiences with nurse practitioners. Really have.
Yeah. So usually, in addition to having the nursing, the initial nursing training and certification as a registered nurse, then there is additional, and then a Bachelor of Science in Nursing, and then more training on top of that. So it is a pretty involved process.
It is.
I'm going to ask Deanne to tell us about her personal sojourn.
So welcome, Deanne. Tell us all about you.
Well, it's been a long one, but I started out in California, graduating at my nurse practitioner program from UC San Francisco, and got a job pretty quickly, which is oftentimes difficult for a new graduate. Oh yeah, it's probably a little easier now than it used to be, but back in the early 90s, it was there weren't as many jobs. So I started out at Kaiser Permanente in Northern California, and I was there probably 2 months when I was asked to start making nursing home rounds.
Oh.
So I was making rounds at the nursing home 1 day a week and working in the clinic 4 days a week. And as time went on, I ended up working there 6 years before we moved to the East Coast. I started working another day and another day and another day. And then I was working 4 days a week in the nursing home facilities that we had, and we kept increasing them because I was out there helping the 2 nursing home doctors see patients. So by that time, I was working 4 days a week in the nursing homes and only 1 day a week in the clinic. And I have to say, I just fell in love with geriatrics. And honestly, I always tell everybody, I always feel like I get more from my patients than I can possibly give. The years of experience and knowledge and wisdom. So I really love it. Most recently, I was working at George Mason, as well as having a practice 2 days a week. It's a lot of balls in the air when you're doing both teaching and all these other things that you have to do in academia.
Right.
So I was doing that, and then I had a practice most of the time 2 days a week, and then some nurse practitioners in our practice started a practice at George Mason as well. So then I had another place I had to be. So it was very, very busy. I loved it, but I got a little tired. So I decided I was going to go back to full-time taking care of patients. And I really, really missed doing that as much as I had done in the past.
That's what I understand. So many nurses, as they move up in the ranks, they sort of lose that patient touch.
Yeah, but I did go up the ranks as far as education. I started out as a nurse, then became a nurse practitioner. Then I ultimately went back for my doctorate because they require now nurse practitioners to start having their doctorate of nursing practice. So I've got all those credentials under my belt. I don't have to do any more of that other than update myself every year.
Right.
But I'm really, really happy to be here,
That's
to
wonderful.
be working full time.
Wonderful. So we're glad to have you.
Thank you.
And I
I'm
know
excited.
Sonia's glad to have you.
Absolutely.
Yeah, because we depend so heavily on the medical center
Yeah.
because so many of us don't drive. And it's very difficult to get off campus to get any kind of medical help. So
Well,
that's wonderful to have you
Yep,
here.
glad to be part of the team.
That's great. That's great. So what else new is happening at the medical center?
Well, so for the next 2 additional weeks, we will have 3 nurse practitioners, which is the full complement of nurse practitioners. But then as of August 12th, we will resume just having 2 out of the 3 that we need. So we will be, we will continue to recruit, for an additional nurse practitioner. I'm just reminding everyone that we are still also recruiting for our 5th physician. And it's a little more challenging because we're hopeful that the person that accepts the position will be someone that could potentially assume the role of medical director once I'm able to step down at the end of this year.
Your dream.
Yeah. So it is taking a little bit of time, and as you know, we certainly want to make the right decision because Deanne and I were chatting as we were coming over here, talking about how attached, the residents get to folks that are taking care of them, which is, I think is really good because that means that, you have that sort of trust and you have that sort of nurturing, personality that allows that bonding to occur.
Right.
And so you really have to make sure that it is the right, person.
And that really is important, I
Yeah.
think, as we get older. We like to feel that somebody knows who we are.
Yes, exactly right. So that's what's happening. And then, believe it or not, in about a month, it'll be time to gear up for flu shots. Yes.
There doesn't seem to be a break in those anymore.
Very, very little break. I will say that the last flu season was very uneventful. We had very limited number of, known or documented cases of influenza. And we will again be given the high dose of flu vaccine, which is recommended by the American Geriatric Society for, residents of the age bracket that we serve. And so I'm just advising everyone to be on the lookout because we will again plan to have flu clinics in multiple sites in the major neighborhood buildings. And then you'll also be able to get the flu shots in the medical center if you're there for a regular appointment. So we want everyone to stay healthy this year. Okay.
That would be nice.
Yes, wouldn't it be wonderful? Yes.
Yeah, I think people try. They try to stay healthy. Yeah.
Well, it is it's a cohort kind of situation, so you're almost forced to, interact with other people.
Right.
So, the hand washing certainly always is important, and if you are feeling that you have illness of any type, you can always call us for advice, but, try to stay away from the main areas where, lots of people gather,
Of course,
like
anytime
dining rooms.
Whenever you get sick, it's a Friday
Yes.
night.
Well, that's okay too, because we are on call. There is a doctor available, even
I
on the
realized that I
weekends.
had to do it one weekend.
Yeah, and after hours. So, with the medical center isn't open, but we can certainly, give you advice and, sort of direct you as to what the next level of care might be.
Right,
So
right.
keep that in mind.
Yeah, well, that's great.
Mm-hmm.
Okay. And Deanna, what kind of plans do you have? Any plans you've laid out as to what you'd like to accomplish?
One step in front of the other, one foot in front of the other.
One
to
foot in
start
front of
with.
the other, right.
I think just meeting and making, connections with all the folks, obviously, that I'm going to be working with, the team, and there's a lot of them. And I keep writing their names down and going, okay, how long is this going to take me? And just being with the residents again is what I look forward to the most.
So you're
And-
mostly over at Garden Ridge, though,
Yes.
right?
Yes.
For now.
For now.
But
Probably, yeah, until we get stabilized
Yes.
with,
Yeah.
with NPs. I'll
Will there
need to
ever be a
there.
time where there would be a nurse practitioner settled at the medical center?
full-time, I don't foresee that. But, you know, it could change, you know, based on the mix of doctor and NP, you know, will sort of end up. But the goal would be to have split time between Garden Ridge and the medical center for all of the providers, because each of the providers have a neighborhood or a unit that they supervise, and then we all have our time that we spend on the short-term rehab unit, and then the medical center. So it's yeah, it's a sort of a revolving door.
Try to spread around and help everybody.
Yes,
Yeah.
that's right.
Yeah.
Right.
Okay. So you're all caught up now as to what's going on, and everybody should understand that we now have a new nurse practitioner. So things should be a little smoother for a little while.
A little smoother. We're still not fully staffed, though, so I still have to ask everyone to just be patient, particularly for the same day sort of appointments.
Right.
Just to realize that, you know, sometimes there are times that we can sort of talk you through a situation that doesn't automatically require a visit, and so until we are fully staffed, I still will ask that everyone's just sort of keep that in mind, and you know, we'll take care of your needs to the best of our ability.
Right, right. I think that's always been true. I appreciate that. Okay, let's see what else we have here, and then we'll